Hey, so if you're suffering from back pain, it's important to remember, and I've stuck with this line or this phrase that's a cliche, but it's very powerful because this too shall pass is important to remember. Now, I always say this too shall pass when I'm dealing with difficult times because usually they go away, right? But if you're dealing with back pain that's lasted for a long time and it's nagging and it's aching and it's irritating, then there's other things that we probably need to look at, and we need to take action on them. And taking action is the most important thing because things will just not disappear on their own if you're doing something that is constantly recreating it. Now, it could be emotional stress, along with sitting down in the same position all day, every day, which is causing inflammation to a specific area. And that's why this too shall pass is not actually happening. So the power of that phrase is kind of like, let go and let the creator do things. And that's true when we're doing the next right thing. And what is the next right thing? Well, the next right thing for our body, and this is our temple, and that's why I always talk about why we should be studying our body more than we study anything else, because this is the only vessel we have, and we're given it. And so we should be the ones taking care of it the most. And we should never outsource that to anybody ever. And that's why I'm a big proponent of learning and understanding your body and teaching people how to move correctly and what to eat so that they're in control of healing themselves when things go wrong. And then also optimizing and maximizing their body for the future. Right? So think of the future you. I want you to think about how you want to be in the future. Well, if you're not doing the things now that will get you to where you want to be, then what's the point? Well, now we need to do the things that are necessary to maximize and optimize health and longevity and reduce aging, and all those things will help you right now. So if you're doing those things right now, you'll reduce inflammation, you'll feel taller, you'll have better thoughts, you'll reduce everything that's causing issues in your body, right? So what do? Well, one, we want to assess our stress level because stress increases certain neurochemicals and chemicals in the body that increase inflammation if there isn't a wax and wane in them. For example, if we're in fight or flight all day, every day, our stress hormones are going to be high, and therefore our inflammation markers are going to be high. So it's very important that we pull back and do things that bring us joy, relaxation, like anything that brings you joy that you do daily will reduce inflammation and reset your mind and help you mentally, emotionally, health-wise. And if your back pain is preventing you from doing those things, then that's the thing we need to focus on first. We need to get the back healthy and strong. So again, let's look at your stress levels. What can you do to reduce stress? Can you meditate? Can you go for long walks that are just low active meditation like walking? What else can we do? Can we do breathing exercises? I've showed many videos on breathing exercises that you can do. How are we eating? Are we eating to reduce inflammation, or are we eating processed crappy foods that are causing inflammation? Are we moving? If you saw my video on exercise, and specifically for the spine, there's low blood flow to the spine. And the reason is because we have like this cartilage protection that helps the spine last a long time. And that's on purpose. So we need movement to get blood flow so that we can heal the area that is causing issues. And that's actually what the whole back program is about. We incorporate nutrition and the emotional side, but it's specifically movements that will tap into your neurology and your spine and give you what you need to start the healing process, to have more flexibility, to have better posture, etc. But that's not the point of this video. I always push and promote that because it's beneficial to anybody and everybody, whether they're dealing with back pain or not. But if you're dealing with back pain, it's even more beneficial. The real question is, this too shall pass. Is that happening to you? Is this passing, or are you continually having back pain, and is it reoccurring? Because injuries themselves recover naturally within about 2 to 3 weeks, depending on the injury, right? Let's say if you have severe trauma, maybe it takes 6, 8 weeks. If you have a small injury, it's going to take 2 to 3 weeks. If you really know what you're doing and how to heal properly, it can take a couple days. And so, yeah, that's the question. Are you consistently dealing with chronic back pain? If so, then there's something in the way. That pain is trying to send you a message. It's trying to wake you up to things that need to change. And hopefully that's where I come in. And that's where you can use some of these videos to dramatically change your life so that you're not dealing with chronic back pain. Now, I was blessed with getting a little bit of pain recently. I haven't had back pain in, I don't even know, 15 years. And when I do start to get it, it disappears because I do the back program. It creeped back in because I've been spending a lot of time testing, moving my lymphatic system, which is very important for your health, on a trampoline every day for long periods of time. And I think I just started to wear and tear. And then I ate inflammatory foods. And then all of a sudden, the next thing I know, bam, my hips and my lower back were bothering me. I think it was more connected with my gut than anything. So that's another thing we want to think about is your gut inflamed? Because if your gut's inflamed, your back is going to be inflamed potentially as well, or other areas of your body. Now think of your gut, like every single spot in your gut has a connection up to your brain. Every single part of your body has a connection up to your brain. So when we heal parts of the gut, you're going to heal other parts of the body and the brain because we're all connected and everything matters. One thing happening to another. For example, if your toe is flexed too much, you can get TMJ. So if your big toe is flexed too much, you can get TMJ. So that's how the body's connected. So that's why when we start to mobilize certain things and stabilize other parts of the body, we start to see the body itself harmonize, right? So if your hips are tight for sitting all day when we're used to walking all day, then all of a sudden, now you mobilize the hips, you stabilize the spine, you decompress the spine, you get more blood flow and nutrients and oxygen. You're starting to eat a little bit more anti-inflammatory. You start to take more rests and de-stress and focus on meditating or going for low walks or whatever parasympathetic activity. Parasympathetic is the rest and digest. That's where the love and peace comes in, and that's where healing occurs. That's why I say give more joy exercises, and then all of a sudden you have more peace and love in your life. So let's recap. This too shall pass. If you're dealing with acute back pain, hopefully it will pass. Now the question is, have you been dealing with it for a long time, and is it chronic and reoccurring? If that's the case, then it's not passing and we need to change something. Even if you're dealing with acute chronic back pain, there's things to do right now that will make that change and decrease the pain, get you feeling better about your life, and doing the things that you enjoy doing, like hobbies, sports, whatever, playing with your grandkids, whatever it might be. Those are the things you want to do. So, de-stress, reduce the amount of stress, meditation, walking, swimming, whatever it is that brings you joy that you can do that's not going to increase the pain level. How are you eating? And, people are always asking, what do I eat? Basically, this is very simple. That's something I talk about in my book, intuitive eating like from the earth, but what you feel your body needs. Is your body craving certain fruits and vegetables? If so, take them in because you're probably needing the nutrients from them. So everything from the earth, if you want to just say, okay, what do you need to eat? How do I need to eat? Just eat things from the earth. So lean meats, fruits, veggies. If you have a bad digestion, maybe you need some cooked foods. Raw foods can be tough on the body, can be very hard on the body. So we want to make them easier, more digestible. And that's basic, just the basic simple. We have a lot of different meal plans, but that's just the most basic. And then movement. What are you doing? Do you know how to move to not increase injury, increase damage? Do you know how to move to decrease the pain and get you feeling better? If so, there's many ways to go about that. I have tons of videos on it. You can search throughout this, just movement for back pain. The end all be all is our back pain relief for life program, which is a specific set of exercise specifically for low back, but it helps the whole spine. So again, let's recap: stress levels, nutrition, and movement, right? There are other facets to it, like what are you doing daily? That's, what not to do, but that's another video on its own. So what are you doing daily that is causing issues, right? So are you sitting in a chair for 10 hours a day? Well, if you're sitting in a chair for 10 hours a day, that's not healthy for your spine, right? We're used to being moving. So get a standing desk or walk every 10 minutes. Get up and move every 10 minutes. Those are important things. So I hope that you found this helpful. Remember, if you're dealing with back pain, this too shall pass, especially when you have the knowledge to know what to do and how to get out of the situation. Have a great day.